Well, Breastlink, they sponsor our Monday show, and today we have on Jill Canales, who is their director of their volunteer program, right?
That's correct.
So first, a little bit about you. You've been with Breastlink for a little while, right?
Right. I actually became introduced to Breastlink 6 years ago when I myself was diagnosed with breast cancer at the age of 42, and was sent to Breastlink by my doctor, who felt that it was, heads and tails above any other center that she could send me to. So I actually was treated at Breastlink as a breast cancer patient myself. And after going through treatment about a year later, I became a volunteer myself and started volunteering there. I did that for about 3.5 years, and then the woman who had run the volunteer program for about 25 years finally retired, and so I took on that role at that point.
We know all the different services that Breastlink has, and as you found out yourself, just a great facility.
Yes, yes.
So what's the need for a volunteer program, and what does it do?
Okay. Our volunteer program is extremely unique. It's the only one that I'm aware of. And what we essentially do is all of the volunteers have had breast cancer themselves. They've been through all different types of treatments, surgeries. Some have had chemotherapy, some have not, some have had other types of hormonal therapy. And so what we do essentially is help a woman who's a newly diagnosed patient. We offer basically a peer mentoring program.
Okay.
So we're there as a support to them, to help them take notes in their initial appointments, to help them understand kind of the journey that they're going to be on. And we follow them through their treatment into their survivorship. And so it's our job kind of to offer them hope, because at the initial diagnosis, it's very scary, and for a lot of women, they're shocked, they're very surprised, and so it's our goal to help them through that process. And that's what we do.
Because all of you who've been there, you can give a very personal view and scope of what they could expect and the feelings and someone to talk to.
Exactly. And although every woman's breast cancer diagnosis is different and their journey may be a little bit different, there's commonality to all of us who go through this journey. And as Dr. West himself has said to many patients when I'm sitting with them, obviously he's an expert surgeon, but he'll look right at the patient and say, but I've never had breast cancer. And so that is a service that Breastlink offers to their patients so that they are able to connect, with another woman who has been down that road.
Now, currently, that is done out of the office in Orange, but
That's
you were
correct.
telling me they're looking to bring it here as well,
Yes.
the Laguna Hills office.
Well, actually, our volunteer program is based out of Orange, and we do the vast majority of work in Orange. However, we do see a lot of patients from the other Breastlink offices. There's a lot of patients that will see Dr. Curcio or some of the other doctors from other locations, but they may come to Orange for some of their treatment. So we actually currently work and volunteer with many of the patients outside of Orange, but we're also looking to add a volunteer program in Laguna as well.
Okay, for someone who is interested in this, and they've gone through all this, do they have needed to be a Breastlink patient, or any woman who's
They are
gone
not
through this?
required to have been a Breastlink patient. Most of our volunteers have been, because they know the expertise and kind of the treatment that they received at Breastlink, and they want to be able to give back. But it's certainly not a requirement. In order to become a volunteer and work with our patients in that capacity, you do need to have had breast cancer.
Which makes sense.
Right, which makes, But we do also have other opportunities for, for maybe college students or people out in the community who just want to give back in some capacity.
Oh, very nice.
So there are opportunities for other people who have not had breast cancer as well.
Okay, as far as the time given by the volunteers, does it just vary?
Gosh, it varies dramatically. We have women who come into Breastlink and work, maybe a half a day every week. We have women who just volunteer by phone, and they'll
Okay.
make phone contact with our patients. We have some women who put in a lot of hours, and some women who have full-time jobs, have children at home, that kind of thing. And so they're, the time that they have is much more limited. So we have a really wide range of hours that people are able to volunteer.
All right. If someone wants to do this, the number that I put on the screen is Laguna Hills office, and I guess they can call there and from there get your
They
number,
can,
right?
or I can give you the orange office
Okay.
number if you'd like
Sure,
that. Okay.
sure.
The number is 714-541-0101.
Okay.
My extension is 14330. But in case that's too many numbers, you can ask for Jill Canales or the volunteer program.
All right, very good. And I think this is wonderful what you folks do and all the time and effort that you put into it. And it's just one of the many services that they have at
Yes.
Breastlink. So
Yes,
it's,
it is.
I can see the importance of it.
It is.
As you said, can be a top surgeon there,
Mm-hmm.
but if they haven't gone through it, and it's a whole different perspective.
That's correct.
Yeah.
And the reason I became a volunteer myself is through my treatment, I saw how one woman really changed my perspective of dealing with this diagnosis 180 degrees.
Oh, great.
So I went in thinking if I can do that for one woman, for one woman out
Yeah.
there, then I will have served my purpose. So
All right, Jill, nice to have you on.
thank you so much. I appreciate it.
Thank you very much. And again, Breastlink Laguna Hills, right over here by the mall. And that's their number there. And you can always call that number and ask for a volunteer program. They'll get you connected. They'll give you the right number to call afterwards, 949-770-0797. Thank you very much.
Thank you very much for having me.
All right, nice to meet you, and we'll be right back.